I call this the osteoporosis or osteopenia setup. What do I mean by that? What I mean is that the advice you typically get from your primary care doctor is a setup, essentially, for osteoporosis. In other words, it doesn't really improve things unless they add the drugs. And so it's essentially a greased path to put you on the drugs. So what do the primary care docs and other doctors tell you if you have bone thinning identified and you're therefore at risk for hip fractures and other kinds of osteoporotic fractures? They tell you to take calcium, right? And if they even mention diet, they say such things as cut your saturated fat and eat healthy whole grains. And then they might make mention of vitamin D, typically saying things like 400 units per day is enough, sometimes 1,000 units or 2,000 units, and usually don't even check your blood levels or accept abnormally low blood levels of the 25-hydroxyvitamin D. And then they proceed to write you a prescription for drugs like Boniva, Actonel, Fosamax, or Reclast that have some pretty nasty side effects, like death of the jawbone that requires extensive reconstruction of your face and jaw, or death of the femur, part of the femur bone, the thigh bone, likewise very painful, very traumatic, changes your life, very bad thing to happen, and they're expensive. So these are not perfect drugs. They're not entirely benign drugs. But your doctor very freely dispenses these darn things to compensate for a program that is calcium, etc., that does not work. What if instead of just going straight to a nasty drug, your doctor sat you down and taught you how to do this on your own using natural methods that don't provide any adverse side effects, but only provided other health benefits, including weight loss, reduction of blood sugar, reversal of inflammation, feeling better, being happier, looking 10 years younger? Wouldn't that be nice if your doctor gave you that kind of information? Well, these are the kinds of discussions, by the way, I have in my Undoctored book, Undoctored: Why Healthcare Has Failed You, and How You Can Become Smarter Than Your Doctor. And I also take this even further and added several more dimensions in my Undoctored Inner Circle membership website. But here I'm going to give you the starting points to get you going if your doctor gave you bad information on how to reverse bone thinning. First of all, we don't take calcium. Let me tell you why. One, calcium has been shown to increase heart attack risk. So if you take calcium as a supplement, there appears to be a surge of calcium into the bloodstream that increases risk for sudden cardiac death and heart attack. So that's not a good solution, right? And it never really worked anyway. Calcium has not been shown to increase bone density nor decrease osteoporotic fractures. So it's a very ineffective idea that you take calcium and you hope it goes to the right place and not the wrong place, like arteries and heart valves. So a flawed strategy. We do not use calcium. We use vitamin D, but we don't just blindly give you some dose X and then accept abnormally low values. We aim for the ideal blood level, 25-hydroxyvitamin D, of 60 to 70 nanograms per milliliter, which typically requires more like 6,000 units or 8,000 units. But the individual need varies widely, so we tailor your need depending on your individual situation. Some people need much more. Some people don't need that much. So why give you one size fits all? Why not use the dose that suits you? It's easy to do. And that increases intestinal calcium absorption. Getting vitamin D just right increases intestinal calcium absorption from your diet, from foods like broccoli and spinach and kale. We cultivate bowel flora. And when you get that right, by adding such things as high-potency multi-species probiotics to seed your intestines, and then you feed microorganisms with prebiotic fibers, and you supplement your probiotic with such things as lactate-fermented foods. When you get it right, the proper species increase calcium absorption from the intestine, also adding to the vitamin D effect. And we also eliminate wheat and grains. And that's important because not only is it inflammatory and reduces visceral fat and body weight, but it also removes the grain phytates. Remember that phytates bind up calcium in your intestine and you pass it out in your stool. So when you remove grains, there's a dramatic increase in calcium absorption. Put that all together. Vitamin D, that increases calcium absorption. Cultivation of bowel flora, healthier bowel flora, that increases calcium absorption. And then also remove grains that also increase calcium absorption, and by the way, should also reduce calcium loss in the urine, calciuria. Put that all together and you have a dramatic increase in calcium uptake from the diet. You do not need to take calcium supplements, certainly not with vitamin D. So we don't take any calcium at all, and we thereby don't expose ourselves to the increased heart attack risk. You don't want to trade osteoporosis for heart attack, right? That's kind of stupid. So we start with no calcium supplementation. Then we get vitamin D right. We eliminate wheat and grains for a lot of reasons, including the improvement in calcium absorption. And we talk about such things as vitamin K2. Not K1 from green vegetables, but K2. That's participant in calcium metabolism. Now, my personal view is that K2 deficiency is really just a side effect of dysbiosis and small intestinal bacterial overgrowth. And that's the way you correct K2. And also by consuming foods that come from animals that have been grass-fed, like butter or other fermented dairy products. They have K2 in them. But in the meantime, because we're a little uncertain about how to get K2 the best way, it is reasonable to take a K2 supplement, like the MK7 form or the MK4 aminotetranone form. That's all discussed in the Undoctored book. It's discussed further, dosing, how to do it, where to find it, in the Undoctored inner circle also. And then lastly, think about exercise that stresses your spine and pelvis. So walking doesn't really do that, right? Nor does swimming. Those are excellent forms of exercise, and biking likewise. But they don't impact the spine and pelvis very much. And so while those are great for forms of exercise, for instance, for keeping blood sugar low and preventing Alzheimer's disease, they're not good for prevention or reversal of osteoporosis or osteopenia. What you need are exercise that stress or provide axial impact, an impact to the vertical axis of your body, the spine and pelvis. That would be like jumping rope for a couple of minutes every day. It would be like playing tennis, where you're moving back and forth, shifting weight, jumping up to serve. It could be as simple as jumping up and down in place 10 or 20 times a day. Surprisingly, that has been examined in clinical trials and is effective. It increases bone density in a few months. Put all these natural methods together, and this has been proven in clinical trials to work. So why would your doctor give you a program that doesn't work, subjects you to increased cardiovascular risk and other conditions, as with consumption of grains, and then prescribe drugs that are harmful and expensive, when you can do it on your own, or at least should give this a try first, a year or so, see if bone density improves. There's nothing to lose. It doesn't cost very much. And this is the undoctored way, taking back control over your health, because as you see, the doctor really doesn't understand health. He knows the path to drug prescription and procedures, imaging and therapeutic procedures like surgeries, but ask him about health and you're going to find a blank stare. So it's your job, it's our job to engage in discussions and put together our collective wisdom to find the answers. And in this case, in the vast majority of instances, people can take care of their own bone health and do a job that is superior to what the doctor would have done.